One night in the emergency room, we admitted a young patient who was 15 months old who presented with high fever. And I remember very well that his parents explained to me that he had come in the preceding day already to the emergency room. They had already found the fever. They hadn't run any labs. They thought it was perhaps like a viral disease, and they had sent that patient home. When I received the patient, I saw that the patient was very lethargic, and we had difficulty mobilizing one of his legs. And so that made me think that that could be a bone infection in the leg. I ran labs, and he had a clear symptomatology of infection with high neutrophil counts and a high CRP. Admitted him in the hospital and started antibiotic treatment. And he responded fairly well to very aggressive antibiotic treatment, because that's what we do when you have an infection in the bone. But then what appeared on the labs in the next days after his admission was that he had profound neutropenia and profound lymphopenia, and we started seeing very abnormal labs. And at first our reaction was, well, is this like some reaction to the infection? And really we didn't know. And because I was trained in hematology, I decided to do a bone marrow aspirate to try to understand what was happening. So I sent the bone marrow aspirate to our cytologist, who was a very experienced cytologist and who immediately recognized Myelokathexis, which was very lucky. And I can tell you that at that moment, nobody in my hospital from a clinical side had ever heard about Myelokathexis. So looking this up online, I quickly discovered that this could be associated to CXCR4 mutations, and was then considered in the realm of congenital neutropenia. This was his second severe infectious episode at that age. We were able to ascertain the diagnosis with genetics fairly fast because of a series of coincidences where we did the right formal examinations at the right time. But I think for many of the patients that I encountered afterwards, the diagnostic process was much more complex, with patients who were often much older and who had gone to see multiple different specialists who maybe hadn't had the right training to think that they should do a bone marrow biopsy, or really putting the symptoms together to understand which genetic disease could be causing those symptoms.